Good day, my name is Dr. Michael Reefe, trained cardiologist, and I'm also a member of staff of the Dominica China Friendship Hospital. Today, the 29th of September, we are celebrating World International Heart Day. And in celebration of World International Heart Day, I would like to leave you guys with 7 warning signs of a heart attack. A heart attack is a condition characterized by death of the myocardium. It is also known as myocardial infarction. Myocardial infarctions occur generally in persons who have a history of hypertension, diabetes, smoking, or high cholesterol levels. We have 7 warning signs of heart attack. What are they? It is said in the US that a heart attack occurs every 40 seconds. Internationally, there are 9 million deaths due to myocardial infarction every year. Our 7 warning signs are: 1, and most typical, chest pain. Patients often describe these chest pains as tightness or squeezing or pressure-like feeling to the middle of the chest. Some patients may even describe it as an elephant sitting on the chest, radiating to the left shoulder, arm, and in many cases, the jaw. A second sign of a heart attack is shortness of breath. A sudden onset shortness of breath in context of a patient with hypertension, diabetes, history of smoking, and any of the previous risk factors that I mentioned is often enough associated with the appearance of a myocardial infarction. This results as a complication of the myocardial infarction being heart failure, where the heart fails and blood ends up backing up into our lungs, presenting and manifesting as shortness of breath. Palpitations is the next common presentation in patients with heart attack. Palpitation is a perception of a patient that their heart is racing. This often results as a result of the appearance of malignant arrhythmias like ventricular tachycardias, ventricular tachycardias, and ventricular fibrillations, which are malignant arrhythmias which could be potentially fatal. Our 4th sign being nausea and vomiting. Nausea and vomiting, although are very common symptoms associated with many other conditions, patients who are in context of hypertension and diabetes who have these histories often can present with those symptoms of nausea and vomiting as a result of parasympathetic stimulation. A 5th sign being dizziness or lightheadedness. Dizziness and lightheadedness can occur as a result of a failed heart, resulting in decreased blood flow to the brain, and these patients often feel lightheaded or in many cases present with syncopal episodes of fainting. 6th sign is cold sweat. Cold sweat usually occurs in many patients as a result of sympathetic stimulation, quite the opposite to nausea and vomiting, where it's activation of our nervous system and that manifests as profuse sweating, or what we call cold sweat. Alright? And our 7th sign is fatigue or tiredness. Fatigue or tiredness occurs due to extensive myocardial death or heart death, resulting in decreased blood flow to peripheral muscles. So, the next time you encounter a known hypertensive, diabetic, or someone with a history of smoking who presents with any of those 7 signs, ensure that you take them to your nearest cardiologist and hospital promptly. Help us save a life. Thank you, and do enjoy the rest of our World International Heart Day. Thank you.